We're back with Anne talking about palliative care. We left off talking about advanced planning and the importance of that. And can you follow up a little bit more about that? What actually is advanced planning, and who do you do that with? My guess is, as a nurse on the floor, you don't just walk down the hallway, pop into a room, and do whatever you think needs to be done for the individual.
Right.
There's a whole lot more that goes into it. There's care planning, and there's notes about what's going on in the individual's life. But there's also something about their care plan as directed by the person themselves. Talk to us about that.
So advanced care planning is when, you sit down with your loved ones and you formulate a plan that you want for yourself, in terms of your health care, in terms of if you're unable to make your own care decisions, what you would want your loved ones to request for you.
Okay, sure, yeah.
Yeah. So for example, there are some individuals who say that they don't want any CPR. Right? They say they do want CPR. They would say they don't want a G tube, right? If they're unable to eat or drink, they wouldn't want a G tube. Or if their heart stops, they.
Okay, let me just sort of jump in here for a second. Why would you not want CPR?
Right. So I really encourage everyone to really understand what it means when you're signing up for like CPR. In the movies, they
Right.
they make CPR seem like some magical maneuver that you just pump on someone's chest and automatically they come back to life, right? But in reality, that's not the case.
So in the movie, they're not really performing CPR on the individual. If they were, it would look differently, correct?
Well, yeah. So with CPR, what you're doing is you're pumping the chest, but you're pumping the chest with the goal of pressing on the heart or putting pressure on the heart to help pump blood through the body so that you can get blood to the brain. Because without oxygen, the brain dies very quickly, right? So when the person's heart is stopped, you want to make sure you're pumping what oxygen is left in the blood to the brain. So if you think about it, when you're pressing down on the chest, again, you want to press hard enough that you're actually pumping the heart. But what's in the way? The ribs, right? So for, individuals, especially with the elderly, they are more frail, their bones are more fragile. So when you're pressing that hard, a lot of the times their ribs will break, right? And with broken ribs, you may also get pulmonary hemorrhage or bleeding in the lungs. You may get spleen lacerations, liver lacerations. And in the very slim chance that they are revived at the hospital, they now have all of these other complications that they have to deal with. The other thing to keep in mind is that, again, when your heart is stopped, there's no blood or oxygen pumping, right? So in that time, your brain may be losing a lot of oxygen, and therefore the brain tissue may be dying, right? So again, in the very slim chance that you are able to be revived at the hospital, you may come back with significant brain damage and a significant reduction in quality of life, right? The individual may not be, themselves anymore. They may not be able to eat or drink on their own. They may not be able to do anything on their own. They may require ventilation. They may require 24/7 nursing care. And you're just really prolonging suffering at this point and decrease the quality of life.
Yeah. You're not giving a person a good quality of life. And I can only imagine the consequences of some of that. So again, going back to the advanced care planning, that's why it's important for us to let our family know what we want, because what's the go-to place for most family members?
Right. So when families don't know what the individual wants, or they may believe that prolonging life is the best thing to do, because they may feel that, if I don't prolong their life, I'm essentially killing or I'm ending my loved one's life. However, I would challenge them to reframe this type of thinking, because remember, your loved one has a chronic or a terminal or a life-limiting illness, and that's ultimately what is ending their life, right? They're dying naturally by their disease or their diagnoses, their comorbidities, and rather than prolonging their life, you may actually be prolonging their dying process or prolonging their suffering.
Right.
So that's something that's really important to keep in mind. And then for individuals, it's really important that you make your wishes very clear on what you do, you don't want, because it saves your family a lot of grief and guilt when it comes to making that decision.
Do most family members agree? So you've got, let's say, 3 siblings. The parent hasn't given any direction.
Right, exactly. So again, if there's no direction and then, all of the siblings disagree, that makes it very hard, to be honest. There's a lot of conflict involved, and it's very difficult for the medical team as well to figure out what to do. So when you make those wishes very clear, the medical team, everyone will sort of follow the wishes of the patient, and then it will sort of prevent those conflicts from happening. If siblings are like, no, I want this done for my parent, and another person's like, no, I want this done, we're like, well, what did the actual individual say? Because remember, it's their body, right? It's not the family's body, it's that individual's body. So we should really be respecting that individual's wishes.
Yes, yeah. And again, that goes back to the person-centered care that we try to talk about. It's not necessarily about everybody else. It's about the individual, the person. What is it that I personally would want in that circumstance?
And it's really important to remember that it's that individual that's going to experience all of those interventions or thing that's going to happen to them, right? So, for example, if you have an individual, sometimes people, they have bleeding in their stool or something, right? Or they have blood in their stool, and we discuss with families like, this could be a sign of a colon cancer, right? Or malignancy. It could be a sign of a GI bleed. And one of the ways that we would investigate that would be through like a colonoscopy, right? But what does a colonoscopy entail, right? You have to take all of these medications to wash out your bowels, right? And then they put a camera up your bum and they look around. But this is very invasive. It can be very uncomfortable. And who is the one experiencing that? Your loved one. And if your loved one doesn't know what's going on, and you're sending them to the hospital for all of these tests, it can be very traumatic and it can be very scary.
So that would be someone, especially someone with some level of dementia.
Correct.
Misunderstanding.
Right. Think about it. If you have no idea what's going on, you don't understand what's going on, and you're suddenly taken to this hospital place, this ER, right? You have people poking and prodding at you, putting needles in you. They may be tying you down because you're getting up and you're trying to get away because you don't know what's going on. It's almost like you're an alien being experimented on.
Yes.
And you can imagine that experience can be extremely traumatic.
Yes.
Right? Especially when you don't know what's going on.
Yeah.
So that's why I don't, a lot of times people believe that, it's the right thing to do to send that individual to hospital, to do all of these invasive investigations, to do all of this treatment. But if it's in someone who doesn't understand, who doesn't know, who can't consent themselves, it can be quite a traumatic experience.
I have a friend, a buddy that I ride with a lot, motorcycle trips and so on. We go back a long way. He had chest pains a couple of years ago, and his wife drove him to the hospital. She dropped him off at Emerge. He walked in, she went and parked. She got a phone call that your husband just dropped dead now. The nurse behind the counter did CPR, and they hit him a few times with the paddles, and they brought him back. Now, for a number of months, and he sort of joked about it, and I know he's fine with me chatting about it because we've talked about it with friends and so on, and on our bike trips, and it's like, oh, great, fine. He said, when I was dead, he said, I didn't feel anything. He said, now, all I've got is pain in my chest. And he said, and who knows what else in the future. So there is an element, and we joke a bit about that, but there is an element about a natural, normal death
Right.
as opposed to a prolonged death. And our session has come to an end, and I really appreciate your education on this, and it's really helpful. Maybe we could pick up a little bit more in the next segment on it. I'd like to talk about the importance of and I'll use an acronym, a POA, and I'll come back to that in a minute.
Sure.
But thank you, Anne, for sharing with us.
No problem.